Hi everyone, welcome to Imaging Study. Today we are going to see a case of migrated intrauterine contraceptive device. Now when we talk about the intrauterine contraceptive device, we get three things like displaced intrauterine contraceptive device, which you can see within the uterine cavity. It can be embedded into the myometrium, or it can get migrated outside the uterus. So in our case, it will be a migrated variety. A 22-year-old female patient came with the history of using intrauterine contraceptive device. There was a history of perforation of the device. Then the patient was managed with conservative treatment and was suggested not to conceive within 4 years. Now after 4 years, when she got pregnant, at third trimester, rupture of the uterus happened. Baby was dead and the patient was managed surgically. To save her life, hysterectomy was done. As the patient is of 22-year-old, the history is not very sweet. Let's focus on the intrauterine contraceptive device. It's still within the abdominal cavity. When the hysterectomy was done, I don't know why, it was not removed. Maybe due to the situation, or the surgeons were more focused on saving her life. Let's see what we can get now on ultrasound. Here on curvilinear transducer view, you can see on right iliac fossa there is a linear hyperechoic structure. The structure is surrounded by an oval anechoic localized collection. So this echogenic structure is nothing but the intrauterine contraceptive device, that is the copper T. So you know the copper T has a vertical and a horizontal part. Here is the vertical part. This is the horizontal part. Now let's look at the area with high frequency linear transducer, and you can see this copper T surrounded by the fluid. It is causing some adhesions and it forms a localized granuloma-like appearance. This is the horizontal part and this is the vertical one. Here's a still picture. You can see the echogenic copper T on curvilinear transducer. Surrounding collection is also seen. This is the horizontal part of the copper T. This is the transverse section of the copper T. We put color Doppler to exclude any adjacent vascular abnormality. There is no acute inflammatory change right now. Here again another picture with longitudinal and transverse sections. The surrounding fluid field area measures around 4 cm by 2 cm. The copper T lies around 2.5 cm deep to the skin. Here's a high frequency transducer view. These echogenic lines are not completely continuous. You can see some gaps here. This is the typical feature of a copper T. Now whenever you see the copper T, you always should use the 3-dimensional ultrasound. Here we have used the 4-dimensional ultrasound. You can see this is the copper T, this is the vertical part, this is the horizontal part, this is the surrounding fluid field cavity. Another view on a skeleton mode, and you can see the copper T here. Here's a still picture of the copper T on different 3D modes. Again another view of the copper T here from different angles. Some machines have different type of 3D modes to make better pictures. Like here we have a scan from different angles, took some slices, and you can see the copper T from different views. Again another picture of the copper T from different views. So in summary, a T-shaped hyperechoic foreign body surrounded by anechoic localized collection is noted at the right iliac fossa, suggesting it to be a migrated intrauterine contraceptive device. Now the take-home message. 3D 4D ultrasound may be useful to help visualize the intrauterine contraceptive device location. Thank you for watching this video. Don't forget to subscribe our YouTube channel and obviously try to visit imagingstudy.com for more cases. See you on the next one. Have a nice day.